Good afternoon, everyone. Welcome to today's webinar presented by PatientPoint, Finding the Next Growth Audience, How Health-Focused Brands Can Unlock Emerging Healthcare Consumers. Today we have Kevin Ungi, Vice President of U360 Medical, and we have Stephanie Webb, Senior Vice President for PatientPoint. So with that, I'll pass things over to our speakers today to start the presentation.
All right. Thank you, Shanae. Good afternoon, everyone. I'm Stephanie Webb. I lead the consumer health focus at PatientPoint, and we work with brands to connect with people in healthcare settings, physician offices, which really are these magic moments when receptivity is at its highest, trust is at its highest, and people are in the mindset of health, wellness, and longevity. And I'm here with my friend, one of my favorite industry thought partners, Kev from U360.
Very nice, thank you. Thanks for having us today. And my name is Kevin. I'm the VP of U360 Medical. And at U360, we work with primarily CPG brands as they're finding new ways to talk about their product and communicate what makes it great to that target audience. So think about like health, wellness, personal care brands available with or without a prescription. And a big portion of the work that we do is trying to find new ways to break through to new audiences and leverage places to grow their existing business in ways they perhaps hadn't thought of. And I believe that's what we're going to be talking about today.
Exactly. Yeah. So Kevin, I realized that we're hearing a lot of the same thing from the brands that we're working with. And Shanae, if you want to advance the slides for us, and that is that growth really just feels like it's getting harder and harder for brands to achieve. Core categories feel flat. Media is more expensive. It's more fragmented. They're being asked to so many options. They're being asked to do more with less, and feels like there's fewer new audiences for brands to match to. So what's interesting is that many of the brands will say, I'm covered, right? Yeah. I've got my broad tactics. I'm reaching all my audiences. There's broad awareness there from TV, social, search. I'm covered. Yeah. But I think part of the underpinning of what we're going to talk about today is that reach doesn't always equate to activation.
That's true. And I think it's also not necessarily like the media is getting more expensive, but I think there's lots of options of where that media is going to go, and there's uncertainty about what is going to break through and where you're putting dollars and how they're going to return. And I think some of the things that we're going to talk about today are areas where brands can grow, and there is a closer connection to the retail from the CPG perspective, which is something that is very powerful for the brands that we work with and that we talk to.
And there's a lot of different ways for brands to think about growth, right? I know that's an area where you focus a lot, Kev, helping brands. Exactly.
Carry on.
You work with a lot of brands.
Yes. No, sorry. Yes. That's true. We do work with a lot of brands. And I think as we think about the work that we do, I would say that there's like two sort of ways that you can innovate growth and innovate products and brands. There's either a commercial innovation, which we'll talk more about today, which is around ways of finding new audiences, new ways to talk about your product without changing it. And then there is product innovation, which is where you're spending huge amounts of time investing in R&D, making new formulas, new product upgrades, whether they are incremental or whether they're truly new and innovative to the market. It's very expensive. And I think as the economy is evolved the way it has, the amount of traditional product innovation that's happening in many of the clients that we partner with is getting a bit smaller. And so yet they still have all of these big targets they have to reach. They still have to make new inroads and find new ways to connect with their customers and then their consumers. And that's really a great role for commercial innovation, because the great thing about commercial innovation is that you don't change the product, and that's so expensive. What we're doing here with commercial innovation is finding a way to break through with the right message to an audience that perhaps you've never considered. and by doing it in a way that really telegraphs how that product is going to pay off to that audience. Excuse me one second.
And it's also, I think, a faster path to growth than product innovation.
Faster path to growth in the sense that many of the claims and stuff that you're going to make and talk about have already been approved. You've perhaps never spoken about them before because the way that we typically grow and develop products is by focusing on, there's only so much information that we can say in a concept, which we know has to appeal to a mass market in order to have the biggest impact. Or perhaps that one claim that has to sit on the side of that box at the grocery store or on the shelf in the pharmacy has to make the biggest breakthrough. And what happens often at the time is that all of the other wonderful claims that you can make about your product, the way you can talk about its science, doesn't mean that they're bad. They're just somewhat ignored because of the way these products were developed. So being able to talk about those types of pieces, claims are already approved, like complicated MLR type review, and we're able to bring that message to the audiences in a new way they haven't thought about.
So with most brands focusing on sort of that broad reaching sort of mass appeal and targeting really just based on demographics, that's where we see a lot of missing and leveraged activation happening.
Very true.
So I think using an example like incontinence, I know that's a category you've worked a lot on.
Yeah, very familiar.
We've spent some time there as well, and it's very easy to just take a broad reaching 50, 55 plus, people aging into this need state and think, okay, I've got my mass covered here, I'm good.
Yep.
But when you look at that through a healthcare lens, you can see these very important, very valuable, deep pockets of healthcare consumer audiences that have a strong need and are very, very different.
Yep.
You've got almost 30 million people in the US with type 2 diabetes, right? Unfortunately, incontinence is a side effect of type 2 diabetes. You have new moms navigating postpartum recovery.
Yep.
You have people with neurological conditions, mobility issues, all their caregivers, right, making these decisions. These are very different life stages, very different ways people are battling with this need, but the same underlying need.
Right.
So the opportunity there is, how do you truly identify what those audience segments are and then activate them?
Well, yeah, and I think not only is it about identifying and activating, but it's also really important that we do it in a way that is true to the intent of that consumer target. And so that when we are playing around and activating in these different markets, we're ensuring that it is the right person, it comes across in a natural way. It is the right moment to be engaging those people. And the message is going to resonate without alienating. People should not feel like they've been targeted for something because of a condition, as an example. And I think when we think about commercial innovation and the role it plays in activating these markets, it really can make a big impact and oftentimes make people feel heard. One of the things that we talk about a lot when we explore these different spaces is many of the consumers and the patients in the world are using these products as part of the treatment regimes that they have as a part of their armory, frankly, for want of a better word. And they are currently not talking about it. So like many of the brands are waiting for this to happen. They're just not activating it. And this space is a real opportunity to grow within that.
And I think one of the reasons why brands aren't activating those audiences, and it's really important for us to double tap on, is that you have to be really careful. And there is some very important and very valid protections around how to target based on healthcare condition, and how do you do that in a way that's both privacy safe and protected while also meeting these people's needs. They have a real need that these brands are ready to fill. So that's what we do a lot at PatientPoint, and we have a very unique way of doing that, and it is reframing that issue from targeting an individual based on their health condition to finding the health environments where these people are most likely to show up. And Sinead, if you want to continue on, yeah.
One of the things that Steph and I partner very closely together, and I sort of bring the idea of maybe a less obvious health and wellness product playing within these sort of markets, there is an immediate like, oh, can we say that? Like, we don't know those rules. Like, we don't know what it is that we can and what we can't say. We haven't ever thought about that before. And there is almost a scariness, I think, that comes across. And what you're able to bring to the table through all of the due diligence and data and access that PatientPoint has, and the way the whole point of care community is really growing. I think this year or last year, it just surpassed $1 billion in media spend. Like, that sort of level of reassurance is out there, and brands are leaning in when they see that exists and that there are companies that can support that.
I also think it's what holds a lot of brands back, right? Is recognizing that, but not having a good, because there aren't very many media channels that are credible, that can deliver at scale, and in a very safe, protective way. So our consumer health network at PatientPoint, we have the benefit of leaning into our counterparts on the pharmaceutical side of the business. So we're working with all of the top 20 pharmaceutical brands showing up in our physician offices. And as a result of that, we have access to this deep, deep well of data, and a really valuable mix of data that gives us visibility into every single one of almost 40,000 physician offices, 125,000 prescribers, understanding what is happening in every single one of those offices, what's being treated, what conditions are intersecting, demographics even. So there is an ability to find the exact right environments where these need states are arising and inserting that brand message in that space.
So with compliance, there is the big point, right?
With absolute compliance. So even beyond identifying the audience, saying, yes, this is an audience we want to go after, we now know how to get them. Above and beyond that, we're delivering that message at the time when they're actually thinking about their health. And that's such an important
context is everything
of this. Exactly. So I think I talked to you about late last year, Kantar did a study and found that brand ads are 7 times more impactful when they're delivered to a receptive audience. And that just resonates so well here. And 7 times, that's massive. That's massive difference. That means every media dollar can be working very differently on a brand campaign, depending upon where it's being placed and where that message is showing up. And I know when we were talking about this last week, I was saying that dollar is working so much harder. And you were saying, is it harder or is it smarter?
Yeah, exactly. I think it's smarter.
I think it's smarter because it is working so much harder because of the place.
This is the difference between the product innovator and the media person. I think about it.
Exactly.
But I think though, like to your point, like yes, it's able to get the right sort of context of what is happening. But I think it's so when like talking about products, making products, advertising products, or any sort of communication, where people are so preoccupied. There is so much information being thrown at people. It's very unusual that you can target somebody when they are in the moment thinking about what this condition is or what a solution might be to an issue that they're coming across. And all that money we throw into TV, like you're competing. I know what I'm like. I'm watching my phone. I'm chasing the dog. I'm cooking the dinner. I have all this stuff going on. I'm not focused necessarily on something that's interrupting my day to talk to me about a health condition that I may not be thinking about. And this channel, it's no surprise really that those sort of 7 times impact are coming through. Excuse me.
Yeah, I think about a a VMS brand for heart health that
Yes.
we were working with, and they could show up trying to meet a man, hypertension, 55 plus, 100K household income.
Just buying his golf clubs or whatever.
Right? Online, he's thinking about his game. He's not thinking about his heart. But you meet that same patient.
Maybe at the end of his game when he's knackered after walking around all 18 holes, he's thinking about his heart.
And yet, when he's showing up, getting ready to have his blood pressure taken at his PCP office, at his cardiologist, that's when he wants to receive that message. That's when he's thinking about it. That's when it is going to have the best chance of activating that consumer.
Well, and when we're thinking about something and we're involved in it, like we all scrub our teeth before we go to the dentist because like it's off top of mind what is about to happen. And we are receptive and ready for that conversation to be had. So, but I think as part of it, like it's also the mindset that people are in when they are engaged in their health also means we have to have a different message when we are talking to them. We can't tell them the same thing that they see on television as when they are in the office, because context also requires authenticity, and it requires the brands to show up in a way that's true to them and also true to the people that they're talking to. When I'm going to see my doctor or my dentist, whoever it might be, I'm thinking about like, what is the information that I need to know? Like, what questions am I supposed to ask? Like, is that relevant to me? Like, I'm not wanting to be sold something. I'm wanting, and if I am, I want the doctor to sell it to me necessarily. Like, so I think having a TV commercial type approach where you are being more general awareness than a lower funnel, closer to the retailer type execution, which this can, like, the stats much better than me, but I think it's 75% of people leave the doctor's office and go to a pharmacy or a retailer within 4 hours.
So good. Yes, that's it.
Yeah, I made that one. It's on a bit of paper this big down here, but that knowing that exists out there though, and we are closer to that level of communication, and then reinforcing it with the doctor and giving, or the at least the inferred conversation with the doctor, if
that's right,
perhaps you have something more important to talk about than a CPG product when you get to see them. I think there is still an element of conversation that has to be had that is true to the right tone. It touches on the right information. Perhaps you're reassuring, or like a comorbidity, like a role that your product could play to support a different diagnosis state or disease state. You have to be careful with that message, and it has to be unique.
And that's where you shine, right? Is helping brands to identify the right message for each individual.
Tell I'm not a very good salesperson, but yes, that is what we do.
Yeah.
And I'm also like, in the context of this conversation, right? Like I'm not a pushy salesperson, because it's not, in the context of being in the moment, in the right time, and the right message. You have to be sincere, and you have to be telling the right thing. Otherwise, it doesn't come across the right way.
And that's how we've worked together in the past. I think the next, Shanae, is really helpful to sort of put this on a path.
How do we do it?
Yeah, this is, we kind of have a good formula here. We've got a path down for delivering brand growth from identifying the audiences.
Yeah, like how do you find the right people? How do you find the right brands?
And you touched on it earlier, but sometimes brands know, right? They know, okay, postpartum women, yes, they have a need for, but sometimes there are insights they don't know, right? So sometimes there are unique healthcare consumer audiences that, we'll hear about them from our practices or our providers, from inside, from the field. And then you uncover also some of these audiences from your research.
Yeah, from the research that we do with the brands. And consumer research is such a wonderful tool. You learn so many ways and new things and insights that often are overlooked or neglected because people don't believe the opportunity is there or the size of the prize is there from a commercial perspective. But when you have these more targeted or new ways, these commercial innovation stories that we can play, those seemingly smaller things can have the scale that they need to break through. And as part of the work that we do together, we can help identify, like, what are those insights? Where are those rights for those brands to play? And just because we have the right to play there, is it a valid thing for us to do? Like, is it going to fit with the brand? And so much of the work we do together is understanding how those two things can come to play, and then what is the right way to then validate and prioritize that as we start thinking about like the audience value and then the growth potential that is within it. And that's a key factor, I think, as you think about commercial innovation and ways to grow the business. One of the organization that U360 Medical and PatientPoint partners with is Immerman's Angels, which I know that you can talk at length about them. But when I first got introduced to Johnny, he was telling me about there is a lemon candy, which is
Yes.
lemon
heads.
Lemon heads, that's it. I was going to say airheads, but that's but he was telling me that they as an example of you think about unique audiences, like lemon heads are given out on chemotherapy wards throughout much of the country, because they're one of the only things that people can take away that sort of metallic taste that you get within your mouth when you're receiving chemotherapy. So like no one in a million years would ever think about that type of communication around a product that's essentially a candy. But like there are these stories that are told here within these great insights that we can help you bring to the surface and find ways to play your product against.
And that's your favorite too, is when you can connect brands that aren't traditionally thought of.
I love that because it's like a little secret. Like, and there are so many cool things that you can do about it. Like another great platform, well, now I'm on my soapbox, but like another great platform, or the thing about this platform rather, is when we think about product development and innovation, like new claims, this is swaying to product innovation and the outside of commercial, but trying to come up with new claims often requires a new way of doing something to the formula or a new product, like which is the expensive part. There is claims that exist in the world, like the #1 doctor recommended brand. Perhaps you're an air purifier. Like, why shouldn't that be within this space? If you've got to live in a home with an asthmatic, like pure air is arguably going to be good for you. Like air purifiers, when we all get to the grocery store or the big box store, wherever we're buying them, they're all kind of the same. Like they're all about the same price. They all make some sort of various claims about a HEPA filter or some microbe that they're going to remove, whatever it is that they're talking about. But imagine within this space where all of a sudden we've got this medical way of thinking about it. It's playing within this area. Is there a stretch, okay, maybe, or is there an opportunity to start getting to the point of a claim where you're then advertising the awareness, the drive that you get through this channel, then potentially looking to have those claims qualified through things like #1 doctor recommended, which then lands on the box when you're going to buy it and expands beyond that channel. So like prime example of a way where potentially seems a little bit niche at the beginning to activate this underutilized audience, but then has lasting impact beyond the initial setting, which from a CPG perspective is always a big thing that we try and achieve, especially on behalf of our clients who may not naturally want to play within this space because it's, oh, that's a pharma thing, or that's not for us.
Right.
I told you this was a soapbox. I could go on about that.
I love this soapbox. So we've identified the audiences. We've validated.
That's true.
They've got the scale. They've got the connectivity to the brand. This is meaningful enough to go after.
So what do we tell them, right? That's the question.
What do you say? Right.
So the way that we think about that is at U360, we are, I don't want to say we're quite simple, but we're much like all the consumers in the world who are making 35,000 decisions a day. Like we want to make the right decision and we want to make it quickly. So the way that we distill our message is using what we call our who, how, wow framework. So it really is based on who is the person that we're talking to? What is take the case of perhaps somebody who's in the incontinence space, having just had a baby, like what mindset space are they in? Like where are they at? Like they want to be sure that the baby's crying in the middle of the night, that maybe it's their first child. They're so focused on that. The last thing they want to worry about is like leaking or whatever it is from the incontinence pad. So like by putting the context of the who in that mindset and really understanding that inspirational design target, we can then find a way to connect the job to be done for that product in a way that is true and that resonates and clicks. And so we begin by defining the who, and then remember we're simple. So then it comes the how, which is really the science of the product, like how it works, how it is going to sort of, how are we going to prove or ideally show the superiority of that product, and how that product is up to par and is going to deliver against that very strong job to be done that they have, even more important in health and wellness spaces. And then bringing that together with the wow, is the last thing that we need to do is tell these messages and then have people forget them. So if we can do it in a way that is obviously sincere and authentic, but by showing, not telling, and really bringing it all together as a story, it can have a really powerful impact, and one that hopefully will make it to a conversation with the physician, which I'm always a big believer of what we're trying to do here. Though there's lots of other ways to think about that. But then also carrying that through to the point of sale, which is just going to be down the road when they're at those stores.
Exactly. Yeah, and we've seen your work resonate so well in our space.
Yeah,
and
we've had a lot of success there.
It's a lot of steps, but at the same time, I've also seen you take creative and slightly modify it for multiple audiences so
Yeah.
that it still resonates without recreating the wheel each time.
Yeah, there's absolutely no need to recreate. I mean, our goal here is to activate new audiences and leverage your current products, right? In the way that you're talking, like we're not trying to spend more money on media or a whole bunch of creative elsewhere. We're trying to find ways to grow your business for the lowest investment that we can. So yes, we can think about reapplying or reusing assets you may already have. But I think where there is the bigger opportunity is you have to create custom message. We had that conversation about the context piece. We can reapply and reuse assets. But maybe your product that you're using is got the right to play in maybe more niche or in different subsets of consumers or patients. So perhaps there is maybe something that's appropriate for like a younger infant or a child, but is also appropriate for somebody who's 55 plus. Like a product like that, maybe the 20% of the message might be different at the beginning and the end, but the bulk of what's happening at the middle, because it's educational, it's talking about the product, it's connecting in a way that isn't TV advertising, right? So like we're able to reapply those messages for different groups, but not a whole lot of money. So like maybe it's going to be in peds, maybe it's going to be in derm, maybe somewhere else.
Yeah.
Did I say that right?
You did, absolutely. And then where PatientPoint comes back in, right? You do the magic, the messaging.
We do the hard work.
Is created, and then we find the right environments, the right spaces for these messages to be delivered to the people that need it the most. So that's the data analysis that happens on the back end to ensure we are meeting the right people when they want to receive that message. And again, at a place of highest trust, and because health decision making is different from other decision making.
Arguably, you're more invested, so that in itself means it has to be different.
Right.
But you're right though, like you are able to do all of that magic, but you also, I think, one of the things that I think is great is you're also able to provide the trust, and also when we have these conversations with our client teams and try and bring them along for this growing journey, the first thing they're all like, oh, our insights team, they'll figure it out. And you guys have been so wonderful with like working with other insights teams, but we also have to prove this tactic is worth the investment.
Exactly.
And without that, we wouldn't be able to reach these audiences in different ways for the great levels of cost savings, frankly, from a product development perspective.
Yeah, and that's what rounds this whole cycle out, right? Is putting it in market and then proving it out, and then not acting on instinct, but acting with information, right? Measuring the impact of these audiences through brand lift studies, sales lift studies, getting the information from that to inform, okay, is this moving the needle? Are we ready to scale? Is this something that could really make a difference for the growth of our brand? So,
and from a brand perspective, like often we hear like, how do we review this and think about this in our media mix compared to everything else? What is the apples to apples and comparison that we should be finding? And you guys have always done a good job of explaining that.
Yeah, it's not replacing, it is additive. This is pulling in new audiences in new ways. So
and delivering the growth.
And delivering the growth. Exactly. we have an example in here to sort of bring this idea to life.
Yep.
It's a category that's generally considered pretty mature, right?
Yeah, pretty boring for one of the best.
But so oral health. When you think about oral health, right, it's hard to really make big strides in this category, but
It's a lot of competition.
a lot of competition,
A lot of toothpaste when you get to the grocery store.
a lot of options.
Yeah.
Yes, exactly. When you think about finding opportunities for growth, again, looking at it through a healthcare lens, there's a lot of groups that have really, really high need for enhanced oral health. I know you've done a lot of work in this
We've done a lot of work in this space, and it's not even the question of like, I think this is a much bigger topic than just what we're talking today. But for some reason, oral health, and this is an Englishman saying this, oral health is somewhat neglected in how we think about our health and wellness as a separate thing. Like, I still don't understand why we can't use our traditional health insurance at a dentist, but the way and the level in which our oral health impacts the rest of our everyday body health, whether it's in our cardiovascular system, that level of inflammation can cause so many issues. My colleague Dan, his brother is a cardiologist, a surgeon, and he said, yeah, if I have a patient coming in and they're doing their pre-op visit before they're going in to have some work, he's like, and I see they've got gingivitis and their teeth are bleeding or their gums look swollen. He refuses to do some of the surgeries, depending on what it is, until that is under control because of the impact that can have.
Yeah.
And like oral health is such an important part of our everyday health. It's a massive opportunity to message that to all of these different groups of people and do it in a way that makes a massive difference. I mean, and this was the functional level, without even going down the emotional road of like how teeth make people feel and the impact that can have. I know you have more data than I'm just rambling here about the exciting story parts we can tell.
There is, and I think everybody's kind of, coming to be aware that oral health is tied to whole body health. But yes, there are certain conditions that are particularly impacted by oral health or can impact oral health. So we actually did some work, you can see here on the screen, with the Chippa Health and Hand Foundation to drive some of this awareness, education around oral health for a handful of conditions, one of them being heart health. So you can see we have messages that showed up in waiting rooms, exam rooms, and that's a pretty jarring visual of a toothbrush, right, showing up in a cardiologist office or a PCP office, not what you would immediately expect.
That's true. Yeah.
But when you engage with that message, you immediately can see that does make sense here. This is something.
Well, and when you think about like the types of disease states that you're talking about, you mentioned it's cardiovascular, it's diabetes, it's like some of the biggest health conditions that are affecting our country and developed countries around the world are all these common morbidities, and poor oral health has a huge swing in impacting what that outcomes are going to be for these patients. I think it's a really important topic that we talk about.
It is, and Chippa agrees.
Chippa agrees, yeah.
The Health and Hand Foundation. And so
to the choir, apparently.
When we ran this campaign, we did measure the impact to see, okay, what's happening here? Are we able to move the needle on these very important audiences that need this information, and more importantly, need to start taking steps to upgrade their oral health tactics, things that they're doing with their regimen?
One of the tactics, like 12.8% of people say they were more likely to use daily mouthwash.
Mouthwash, yes, 12 point.
That in itself.
Those exposed, right? 13% more likely to start incorporating mouthwash.
To make assumptions like 13%, not 12.8%.
12.8%. 12.8%. Either way, on 6 million people, that's hundreds of thousands of new users of mouthwash as a result. This was an unbranded campaign, but you can imagine if a mouthwash brand showed up amidst this message along next to or delivered a similar message.
Well, and from a growth perspective, though, these are new users who probably weren't engaging in the category anyway, or at least not on a regular basis. Like,
Yes.
and one of the things that we do know is when you have exposure to this type of messaging within this environment, you're also more likely to become a repeat user of these products
That's
and
right.
engage with the category longer.
Absolutely. It is creating people that find out about products either from their doctor, from their doctor's
Right.
office, become more loyal lifetime users. It is a default,
Yeah.
right? This is a brand my doctor prefers. There is a level of trust there, and people stick with what
Yep.
they have learned from their doctor.
Yeah,
So
they do.
yeah.
And that's also an important point. Sorry, to go back to the messaging. Like one of the things that you know, it's particularly in the world of CPG, like there is an element to be said about like, oh, it doesn't matter, just use one that's free and clear, or use one that is like whatever, doesn't have this in, you'll be okay. Um, we could argue like details to see like what is right and what is not and how true all of that is. But I think that's really important why your message is so custom for this environment, because it is our job as putting the message there to make sure if the doctor's not doing it or they're not getting that information, then we are telling them in a way that is true and confident and is right for the context that they're in.
Right. Absolutely.
Yeah.
So oral health, this is one example, right?
There's
Of
many examples.
many examples in nearly every healthcare and non-healthcare brand category has these hidden opportunities. We're working with a skincare brand now who's reaching GLP-1 patients, thinking about their renewed focus on their appearance and aesthetics and, you know, some physical changes too with loss of elasticity. That's a really interesting, maybe, yes.
But no, like that's also a good way of thinking about it. You said like a skincare brand, but then there's also other brands that you may never really think, like high protein shakes, which are all about guys going to the gym, like when they kind of became a thing, like and I guess there is argument for like some of the it's technically all the same idea, but like for the older generations who perhaps weren't getting enough nutrition, people on GLP-1s, like they need to have that high level of protein. Like
100%.
that is a thing that is muscle loss from GLP-1, terrible thing that can happen to you. There are ways that you can start talking about this to supplement and complement the regimen that they're already going through.
Yeah, that's a big topic.
Yeah.
Big topic, GLP-1s. And there's also audiences not hiding in plain sight. So the big audience, what's the number 2 most common, I'm putting you on the spot, number 2 most common reason for people making an appointment with their PCP, going to visit their PCP? The complaint.
I know the answer to this.
I'm asked, just take
Oh, okay. Hang on. Say it one more time.
The number 2 reason why people are making an appointment to go see their PCP. They're going to their PCP to
for the annual physical.
Low back pain.
Lower back pain.
Lower back pain. So the pain.
I don't get off the couch, so I don't have that issue.
You know, the pain category, right? The orals, the topicals, the need for relief. These people are coping. It's going to take a long time before they get to PT or some sort of, you know, advanced care. They're going to be suffering through this, and they're going to need some help. So be there to meet them when they are showing up. They have that need. You can be the solution.
Well, and you also can bring the story of why you are the solution to them in a way that they maybe never have thought of, or perhaps you've got some newer type product that's going after like nerve care in the nerve care category, or something like that, which I mean, like when you go to Kroger, you walk around, you're like, oh, I've got a headache. I know where like the acetaminophen is going to be. Like I know where that is. But like if it's a unique condition or something that's new, I don't know where a product like that would be at the grocery store. So I think this space is also a place to educate, knowing that they're going to go there. Like, hey, find us here. Like you can get this here, which is ultimately people are going for their solutions. And this whole idea of health is about improving lives and outcomes, and whatever we can do to help you get there and understand it is relevant.
And all of this work is being done without having to do anything with the product.
That well,
right?
It took a long time to get the product there in the first place. It's just perhaps not been spoken about in this way before.
The brand attributes, and it's using the things that already exist to apply it in meaningful ways against meaningful audiences. In a meaningful
place, and also potentially launching new categories. Like if you think about the realm now of like clinical strength deodorants, like that all was born out of hyperhidrosis and a very serious condition. Now it's $1 billion category, which all the brands have programs in, products in, and all based on these little insights that happen.
Yeah, exactly. Well, I think we can sum it up.
Oh, there's 3 points to take away. Look at that.
Three takeaways. Number one, you can make people aware, right? There is that broad messaging that can and should happen, but there's a big difference between just making people aware of a product and actually activating them towards using your product, buying your product, identifying their need with your product.
Well, yeah, and not just like bringing the awareness and like activating that audience, but also making them take it off the shelf and put it in their cart. If you can convince them or show them, demonstrate to them why that product is the right product for their mindset, their condition, their job that product needs to deliver, it's easy to grab. We're drawing the 100 decisions that we have to make. So the last thing I want to do is stand at the grocery store and go like this between two products. I just want to put it in and leave.
Right. And
especially this time of year when my car's getting cold the whole time. It's
yes. And so building that brand differentiation, right? Getting that decision made before they even get to the shelf. So there is no comparison. It is.
And making sure that your investment in these channels is paying off. Because you don't just want to raise awareness, you do have to sell the product and make them buy your product.
That's right. Yeah. That's right. Second, I don't think there's any category really out there that we cannot find a.
That's my favorite part, is trying to find them ways in. I think it's so much fun.
Yes. And thinking about new ways and new needs for products within the healthcare consumer space and then applying that.
And the best way to find that is to talk to the people who are using these products. Like go out and make connections with patient organizations, find ways where you can really learn and understand people are using your products in ways you don't expect. And when you can get those insights, that can unleash a whole lot of information, a whole lot of growth space.
Healthcare providers are another. When is this need showing up? When is it arising? And finding those patterns and then showing up in those spaces.
Exactly.
And then lastly, context clarity measurement unlocks growth. So
like Mrs. Kirby on my first day of high school. Kev, be in the right place at the right time, doing the right thing, and everything will be okay. And it's a takeaway for this. At the time, I thought it was about being in school, but apparently it's about brand growth and strategy as I've got older.
I love it. Yes, absolutely. Well, thanks for having this conversation, Kev.
No, thank you for
I really enjoy it. I always love talking to you. And Sinead, if there are any questions. I guess we can take a look as well. Any questions from the audience?
Here, do you want to? I'll read them.
Okay, read the first one.
I've seen this type of approach before, but it seems like scale could be an issue. This is a good question. Is this something that can truly move the needle nationally?
Okay, great. Yes. And this is something we've heard before too, right? We are often thought of as kind of a niche tactic, maybe a stealth marketing tactic, something sort of over here on the side to do maybe, but the truth is, and I don't even know if you know this, PatientPoint is actually the nation's largest digital out-of-home network. We have more privately owned interconnected screens than any other provider. And we happen to be all based in the healthcare space, in healthcare environments. So 40,000.
Samsung or whoever sells you all these screens.
Literally, LG, yes. LG. In terms of scale, you think about 40,000 offices. To put that into perspective, that is more than all of the Starbucks and all of the McDonald's in the US combined.
What?
Yeah.
Wow.
Massive.
Yeah.
Massive reach, hundreds of thousands of healthcare visits annually. So that scale is what allows us to draw from such an enormous pool of needs and really laser in on a highly precise and targeted group of.
And I think as an indicator, you mentioned like often people think it's sneaky, like or like a little tactic they don't want to talk about. And at least in my experience of that, the reason is because the channel works so well, they don't want competitors to find out. Like that is another true statement that I see a lot on my end.
Yes. Yeah.
So yes, I think the answer is the scale is here to move the needle nationally. All right, the next question is this better suited for a smaller or challenger brand, or can large national brands scale this effectively?
Okay, so we work with some of the largest
That's true.
consumer health brands that do take advantage of exactly what we're talking about, right?
Yep.
That nationwide reach by activating and leveraging and owning these very important healthcare consumer audiences. One thing we didn't even talk about is we deliver category exclusivity. So the brand comes into the network in that office, they're the only brand within that category that can show up there. It's what elevates them to be perceived as doctor preferred. It's what, is the
scale
choice.
Which is important.
Exactly. And it captures, like in that oral health example, it's capturing all of that need and that we are creating in that space. Conversely, yes, we also work with challenger brands.
Yes and yes.
Because it's smarter.
Yes.
Right? It is working
smarter,
harder and smarter versus, the competition that where they may be outspent.
Yes.
In traditional media.
Outspend, but we can outthink with these challenger brands and these tactics.
Make our dollars work 7 times harder.
Yeah,
right?
but on the big brand side though, there's also something true about the competitors come after the big folks, or maybe some of the legacy brands that have these important, powerful things like #1 doctor recommended brand. Like kind of touched earlier on, is there a role for this type of growth strategies to start stealing some share away from that so powerful claim? So I think by having the category exclusivity and having the exposure here, there's an element of protection against those claims for the power brands that exist in the world too.
Yes.
So
yes, it's creating that competitive moat and protecting those brand assets.
Exactly.
Yeah.
Exactly.
Yep.
How it all works together. Okay.
Can you read it?
We got another one. This was amazing and fascinating. That's the end of the comment.
Whoa.
No, I'm joking. As a value challenger brand selling generics, what tactics can we utilize to reach the right audience and show them value beyond price, but in quality instead? My favorite question. Value. One of the things I always say all the time is like price is a claim. So if we're selling something that is not necessarily the most expensive thing in the world, does that mean it doesn't work as good? And the answer is no. Like there is a way to tell that story if you find the right way to break through and the right way to communicate to them, which goes back to that who, how, and wow, and unlocking what those consumer insights are. Maybe a reason why they're going for a generic product. I'm sure there's lots of them. But either way, tailoring that communication to explain, there's nothing wrong with that. It's the way it should be. We spend a lot of time justifying why something is very expensive, and it's always so that we can increase the profit here for the shareholders. But there's no reason why these stories should not be told about the generic products too. In fact, potentially even arguably more important if you're having to compete against those bigger dollar messages that are elsewhere.
Great.
That is the end now.
Fantastic.
All right.
Okay, well, clearly we love talking about this.
We talk about it all day.
Love talking about this together. So we welcome, sharing in some ideation with
more than happy.
any brand or category that might be interested in exploring this idea further.
Ideally, the most left field for me. So I can ponder at it all night long. Like, how would we play here?
We've got the Consumer Healthcare Products Association audience here. So
but yeah, thank you so much. We appreciate the time.
Well, thank you, Kevin and Stephanie, for such a great webinar and experience for our attendees. We want to thank our attendees for participating with us this afternoon. You will be prompted to take a brief survey. I promise it's quick. That helps us to develop more content for you all. Thank you so much for participating with us, and we look forward to seeing you at our next CHPA Academy webinar. Thank you, everyone.
Thank you.